It can be hard to know where to turn to at the first signs of memory loss. What if there was a transformative, simple saliva-based test that could accurately detect Alzheimer's in a manner that's non-invasive and robust? What if the pathological markers associated with Alzheimer's could be more easily identified at the earliest stages? What if determining the likelihood of presence of Alzheimer's in the brain could help assess the appropriateness of approved therapies for its removal? This medically scientific achievement is not only a promise of the future, it's closer to reality today. My startup is working towards licensing and commercializing patented Purdue-developed technology to create a saliva test that utilizes biomarkers that are over 90% accurate. My experience lies in being able to currently continue conducting Alzheimer's research with numerous Purdue faculty since high school, and to have had my work published and cited. This technology utilizes swab spray mass spectrometry, which basically you take a saliva sample, you dip a medical swab, a specially designed medical swab, into it, you ionize that sample, and then you apply it to the mass spectrometer, thus saving time for analysis and minimizing the amount of sample volume needed. This easy-to-administer test will help facilitate early diagnostics and will be beneficial to patients by distinguishing diseases associated with cognitive impairment that may be similar with symptoms, other symptoms, and clinical presentation. This test will allow for clinicians to basically detect Alzheimer's early, enable patients to really have a better understanding of their cognitive brain health, and be able to take more proactive steps early on at the tip of the tongue.
What's the current status of SBIR, STTR, other funding?
Yeah, so the technology so far has received NIH funding. We're looking right now to seek a seed investment in order to carry out a proof of concept test to validate that the dihydro S1P metabolite can be, continue to be an effective marker utilizing the technology developed here. So we have not yet gotten SBIR funding, but there has been NIH funding so far on this technology.
How do you take this out of the lab to commercialization? Do you see this being like a 23andMe at-home kit, or is this something that you're going to do for your doctor?
Of course. So there's a number of ways, number of modalities by which you could, commercialize this. So number one, you could license it to a lot of the larger laboratories like Quest Diagnostics and such. Another approach would be to take the device and, sell it or rent it out to a number of medical specialties or clinics as well. So it could be done so it's something that very much is applicable both in a laboratory setting as well as in a clinical setting, and that's really how it could. It's something that's not just only in the lab. It's something that could also be sold and utilized. It wouldn't necessarily be a 23andMe kind of situation. It wouldn't be an at-home kit. You would mostly have to go to your physician to get the test done.
Is there sort of mature consensus within the medical community that is a marker, the marker that is significant in confidence inspiring?
So the evidence for now is that, there were 2 large clinical studies that were conducted with over 1,700 participants that validated the accuracy of this marker. Now, of course, to be able to take it on to the next step and be able to commercialize it, there hasn't been any study yet that has contradicted these findings as of now.
And I would think on licensing technology, the patent portfolio would be very important. Is there sort of a pipeline of patents that you could anticipate?
Yeah, so the patent, right now there is one issued patent. There could be other patents issued on, maybe if we use different reagents or if there's a slightly different approach that's utilized towards, whether we use slightly different reagents or tools, that's also could be where the patent is applied towards. Additionally, it could also be applied towards, not just Alzheimer's specifically, but, patent that covers, detection in other forms of dementia, such as Parkinson's, vascular dementia, and such.
What's the most urgent thing that you as a company have in front of you right now?
The most urgent thing is the fact that, a lot of drug trials fail because I think practically there is not they're not detected early. We try to administer treatment when the disease has kicked in for a number of years, and it's very important to create an early diagnostic to first and foremost improve the quality of lives of patients, but to also improve drug trials and ensure for a more efficient, pipeline. And a lot of other pharmaceutical companies that try to develop novel treatments as well.